access our records in basic Web 2, how are they going to get to Web 3? Or is it that they have to bypass Web 2 altogether and get straight to Web 3?
I think that's a really good question, and it's the migration from what we have to the future. But there's a very interesting project that's coming out of Kenya, actually, called Afria Record, and they are working, and they have been working right through the pandemic on a self-sovereign health data wallet, and working with a suite of hospitals in Kenya to enable this to take place. So what I'd say to you is that people are developing the tools to be able to do it, but you're going to need the consent and agreement of the people who run the healthcare system and who own all the disparate sources of data to be able to pool it into a place where you can hold your data in one place. And that's a human kind of socio-political knowledge problem. But the capacity using blockchain, by the way, to be able to do the secure transfer of medical records in a confidential way exists, and blockchain actually was used during the pandemic to do exactly that. So, you know, you remember those maps with the big blood red splotches that kept getting bigger during the pandemic? That was all underpinned by a blockchain platform. And there's another company in Colorado called Burst IQ, which again has got a secure blockchain data sharing platform for medical records. So sometimes it's not the technology that's the problem, it's the human response or the human willingness to take on the technology that's a challenge. But pandemic gave us an opportunity in healthcare that we wouldn't otherwise have had.
And then one more question. We do not own our data records. So,
no.
At all. So how do we get to Web 3 when fundamentally, you know, we own our other data, right? Most of our other data from our social, but we actually do not own our health data. So how do you get to the whole premise of Web 3? And sorry for asking difficult questions.
No, they're not difficult questions. Yeah. They're exactly the questions that need to be asked. But this is going to be a question for government, and this is also going to be a question for international organisations about human rights and data as property, and whether data is your property. You know how we have the Universal Declaration of Human Rights? I believe, and I know people are working on this issue, around data and health data as property and as your property. And at some point in the future, and I can't predict when, the UN General Assembly and WHO are going to make a declaration around data as property, and then governments will have pressure to move on giving you access to that. But you've got so many owners, if you like, all these intermediaries who own the data that will need to be worked with. And it might be in reality that for people like me it's too late, but for children coming up, if they're born and they have a data wallet, and if there's a way that all of their medical data is stored in that wallet from birth, that will change things over generations. So I don't know the answer, but it's really going to take an enlightened government to make it happen. And something like Dubai is a perfect place because there is an enlightened government, and if they see the value and opportunity in it, and most of the records here are centralised, there's a possibility to do it.